My name is Shayne Meadows. I am the co-founder and co-executive director of Advantage Lancaster, a nonprofit for young people trying to help them seek higher education opportunities or post-secondary opportunities. The past year and a half, the COVID-19 epidemic has affected our organization specifically in just ways in which we mentor and connect with young people. It is very hard, extremely hard, to make connections with young people through Zoom. And so I would say probably the hardest thing to do through this epidemic is creating new relationships, building on bonds that we had in the past, just being able to touch your students, give them a hug or a high five, or just sharing meaningful experiences in person. And so we lost out on 18 months or 19 months of being able to share each other's stories, give each other hugs, laugh, smile, and basically have in-person programming. Advantage Lancaster's relationship with Dr. Hamlin is a personal relationship first. So Sharice and I, we are both founders of nonprofits that are run by African American and founded by African American people. So we connect at a certain level through that. So we talk to each other about advice on how can we collaborate, or even, what are some pitfalls in the nonprofit world that we should be aware of, or what are some grant opportunities that we should be aware of. There'll be opportunities for Advantage Lancaster students to work for Patients Are Waiting. So as an educator for 20-some plus years, I work with children. I'm a 6th grade teacher as well as a nonprofit co-founder. So I thought it was really important for me, as far as me being safe and being in the classroom with students, as well as my mom is in her 70s. I just lost my dad, and I just felt like I wanted to hug my mom. And like I said, on a Zoom call, you can't hug your mom on a Zoom call. You can't wipe away tears on a Zoom call. And so I knew as soon as I got the opportunity to get vaccinated, I was going to do so, because I wanted to be safe for my family, for the students that I taught, but on a personal level for my mother. I wanted to be able to be with my family, and it was a no-brainer for me in that aspect. As far as the pandemic affecting communities of color, anytime you have extreme situations like a pandemic, not like we have these all the time, but it's always going to affect communities of colors or those underrepresented in life even more than other communities. And so I would read in the paper or see on the news the numbers and the disproportionate rates of how it was affecting people of color. And so I thought it was very important for me to do my part in making sure that I was safe and making sure that people in my family could be safe. I just thought it was just really important for people of color to take it seriously. I'm very optimistic when I look at what Patients Are Waiting is doing. I mean, they're mobilizing. I mean, every weekend you see them offering the vaccine to people. And I'm not sure what the turnout is, but they're not stopping. And so that gives me hope that, there are people out there that are continuing to fight and, get that message out that the virus is real. And if you want to be safe, this is an option for you. So I'm very optimistic, as far as I do know that there are healthcare workers and there are people that are, still fighting the fight, as far as making sure that the right information and the vaccine is getting out to people who may be reluctant, who may have some hesitancy.